यू आर वॉचिंग द ऑफिशियल बिग एफएम पेज और आज है 4 फरवरी जो दुनिया भर में वर्ल्ड कैंसर डे के नाम से जानी जाती है। एल्केम ऑन्कोलॉजी थ्रू इट्स एजुकेशनल इनिशिएटिव कैंसर पे चर्चा इज स्प्रेडिंग अवेयरनेस अबाउट द रिस्क, symptoms, early detection and prevention of cancer. So let us know more from the experts themselves about the most common question regarding cancer. चलिए जानते हैं। Thank you so much doctors for tuning in and sparing your valuable time with us. तो मेरा पहला सवाल ये है सर, व्हाट आर द रिस्क फैक्टर फॉर कैंसर?
Cancer has two risk factors, so modifiable and non-modifiable risk factors. So 70 to 80% of our cancers are being caused by modifiable risk factor, and the most important and commonest modifier risk factor in our community is smoking. So in the smoking and alcohol consumption, so tobacco can be used in a smokeless form or a smoked form. So India is very prone for the smokeless tobacco consumption, and alcohol is the reason for 75 to 80% of the risk factors of cancer. Another modifiable risk factor is obesity, which is very upcoming in our Indian society. So obesity is responsible for breast cancer, uterine cancer and many more cancer. Among non-modifiable risk factors, it includes the aging. So with aging, the cancer incidence increases, and there are certain familial and genetic syndrome which predisposes a patient for a cancer. So these are the risk factors which are predominantly the cause of cancer in our country.
What are the myths and misconceptions of cancer?
There are so many myths and misconceptions about cancer. So today, on the occasion of World Cancer Day, let's bust some myths and misconceptions about it. Usually, patients do ask whether my cancer will get spread after a biopsy. So this is a myth. Usually, cancer never gets spread after a biopsy. In fact, a biopsy will help in diagnosing the cancer. It also helps in detecting what type of cancer it is, and subsequently it will help to plan the treatment and management of the disease.
Doctor, what are the warning signs of cancer?
Cancer of different organs can present with different symptoms. Sometimes these symptoms can be subtle and people may neglect it thinking for some small issue. Some of the warning symptoms which may be signs of cancer are lump in the breast, an enlarging lymph node in the neck or any part of the body, a sudden change in your bowel habits, any blood that is coming out in the urine or stools, change in the color of your mole or skin, a sore that does not heal. These are some of the warning symptoms that may guide the clinician in trying to investigate for cancer. If cancer is detected in the earliest stage, if you present to an oncologist early, cancer can be cured. So make sure that if you have any one of these warning symptoms, you make sure to go and consult your oncologist so that the best investigations can be done and cancer can be detected at the earliest stage.
तो चलिए अब बात करते हैं अर्ली डिटेक्शन की। सो मैं जानना चाहूंगा व्हाट आर द टेस्ट फॉर अर्ली डिटेक्शन ऑफ कैंसर, स्पेशली अगर हम ब्रेस्ट कैंसर की बात करें तो।
Screening tests are those tests which help us to find cancers before the signs or the symptoms of the cancer develop. In breast cancer, we have mammogram, clinical breast examination, self breast examination, and MRI as screening tests. Mammogram, it is a specifically designed X-ray to view the breast. So in this, we can catch the tumors or irregularities in the breast at an early stage. Clinical breast examination, in this, medical professional looks and feels for any changes in the breast, including skin color changes, nipple changes, breast size changes, and shape changes, etc. Next is self breast examination. In this, the woman looks and feels for any changes in the breast like size, shape, nipple changes and nipple discharge, etc. And if any doubt, they should consult the oncologist. MRI is used in high risk women and in those young women with the dense breasts.
What are the most important preventive measures?
Most experts believe that cancer is preventable and the risk of developing cancer can be markedly reduced. The simplest method is to avoid the potential causes, the most common being smoking tobacco and excessive alcohol consumption. The other ways of preventing cancer would be to avoid direct exposure to sunlight, or by applying sunscreens, or by avoiding contact with chemicals, viruses and other pathogens, and getting vaccinated if available. People who work very close to cancer-causing agents such as chemical factory workers, X-ray technicians, asbestos workers need to take proper safety precautions. The most effective strategy to prevent cancer remains regular cancer screening and lifestyle modifications along with exercise and a healthy diet. Thank you.
Thank you so much, doctors, for such a valuable insight about cancer. So, listeners, whenever you notice any such symptoms, please do not ignore. Consult your doctor immediately. This segment, Cancer Pe Charcha, an educational initiative, was brought to you by Alkem Oncology.
92.7